As Singapore exits the 8-week circuit breaker, restrictions will be slowly lifted in 3 phases, months apart. Some may be unhappy with this gradual transition, especially when they're not allowed to restart their businesses or resume their usual lifestyle.
Let's discuss this further with Dr. Hannah Clapham. She's an epidemiologist and mathematical modeler at the Swee Hock School of Public Health at the National University of Singapore. So, Dr. Clapham, thanks for joining us. Now, in trying to stabilize the number of community cases as Singapore reopens, what challenges do you anticipate in phase 1?
Yeah, so any reopening that's happening now is going to be a balance between trying to control transmission and also sort of allowing activity to continue. So one of the big challenges is going to be detecting transmission when it's happening and where it's happening, and continuing to do as good a job as Singapore has been doing so far of finding those cases and really trying to stop the transmission as it's happening. We of course have some measures that are helpful for doing that, the contact tracing, the quarantine that's been happening, and now there's going to be a whole range of new measures in place as places open up. So the other big challenge is going to be identifying which of those measures are working and how they're working, and also then trying to decide, okay, if we're finding places where transmission is still happening, what measures need to be put in place further or stronger in order to kind of try and stop that transmission happening.
Doctor, given the current infection numbers and weighing them against the risks, is it the right time for Singapore to exit the circuit breaker?
Yeah, as you say very rightly, it's very much a decision made about weighing the risks and the transmission. And so what we're seeing in Singapore, which is to me really reassuring, is this slow reopening of what's happening. So we're not seeing a suddenly, tomorrow we can all go out and do lots of activities. It's going to be this slow reopening that leads to hopefully a control of the transmission and a more measured approach to reopening than we're seeing in some other countries.
So, Doctor, do you think it's the right time then for Singapore to exit the circuit breaker?
Yes, I do. And I think, there's always going to be uncertainty. One of the big things that's an issue with this current pandemic is that we're having to make, or governments are having to make decisions based on a disease that we're still learning about and based on data that they have at the time. And the Singapore government has been doing an excellent job of that so far. And so it seems like a sensible approach that they're taking so far.
Great. Well, the authorities are expecting a jump in community cases when more activities restart from tomorrow. So if the government pulls back on what's allowed during phase 1, what measures do you think will be reinstituted first?
Yeah, this is a really, really tough question, and one that, everybody wants to know, right? We all want to know what we can do and what we will maybe not be allowed to do again. Honestly, it's going to be based on what's seen. So, the measures that have been put in place and the places that are being allowed to open because they're thought to be the safest places and the measures in place to control transmission. But as I said, this is something that we're still learning about. And so what we're going to see in phase 1 is probably quite a reactive and honestly, over the next few months, everything's going to be measured, but also going to have to react to what's seen. So a lot of the measures that have been put in place around workplaces have been put in place because the Singapore Ministry of Health has very good information on where transmission has been happening and how it's been happening in workplaces. And so now the workplaces are opening with new measures in place. They'll be continuing to monitor that, and then we'll be able to say, okay, we haven't quite got this right, or this isn't working quite how we thought it would. And so they'll then be addressing the areas that need to have further measures in place. So unfortunately, I can't tell you exactly what's going to be happening.
Now, Doctor, let's look forward a little bit to phase 2. Now, the government said it will decide later this month if phase 2 can start in end June. Let's say the number of community cases remains low for the next couple of weeks. Is it still a long enough duration to determine that we are ready to move on to phase 2 by the end of the month?
Yeah, so again, this is a really tough decision. So what we know from the disease is that there is, of course, a lag between when transmission is happening and when we start to see symptomatic cases. because of the biology of the disease. There are ways of testing and strategies that can try and get around that. So that's part of what the government will be doing. They'll be putting in place screening strategies to try and understand as quickly as possible what transmission is happening. The other thing to think about is that in the sort of understanding of what's happening in phase 1, there are kind of 2 reasons that we want to know what's happening there. One is whether, are there lots of cases starting to happen, which means that the health systems, we cannot deal with more cases that could be happening in phase 2. So that's one of the reasons that we want to be monitoring it. And the other is that the opening in phase 1 will help understand, as I said, the transmission that's happening, and therefore could be able to guide what's happening in phase 2. So both of those reasons are really important reasons to have the excellent surveillance and monitoring that's in place.
Well, Dr. Clapham, we want to move on to asymptomatic cases, which still remain a concern among all of us. So, from May 18th to the 28th, at least 27 out of 57 cases found in the community were asymptomatic. Can we draw any inferences from the number of asymptomatic cases out there?
Yeah, so asymptomatic transmission is a really important part, it would seem, of the COVID transmission, and that's one of the reasons why it's been really hard to control. So one of the things that we want to know is, firstly, there can be 2 reasons that someone's found to be an asymptomatic. It could be because they're pre-symptomatic, so they go on to develop symptoms, or it could be that actually they have a whole infection in which they develop no symptoms. So those are 2 slightly different things, and sort of when we're looking at the numbers that are coming out, we want to know, and we need the follow-up of those cases or that are found asymptomatic to know which of those groups those are in. From terms of transmission, actually, those groups are quite similar, except for perhaps the truly asymptomatic might have a longer course of infection in which they will not be showing symptoms and therefore will not be picked up. But that asymptomatic transmission is the reason why it's not sufficient to just isolate symptomatic cases, why we need to have the quarantine, why we're starting to have to wear face masks when we go out. The other thing to note here is that we're finding now asymptomatic cases because we're looking for them. So the testing strategies in Singapore are changing now as the government was thinking about reopening, was trying to understand more about what was going on in certain pockets of the population. So at the beginning, we were very much just testing symptomatic people. So of course we didn't know about asymptomatic infections, whereas now the screening that's going on will pick up asymptomatic infections. And the final thing to think about when we're thinking about what this means for the whole population is that from studies here and in other places, it's becoming clear that not only does disease severity vary by age, so not only are you more likely to have a severe infection, you are probably also more likely to have a symptomatic infection depending on different age groups. So, if we're currently screening large groups of the working age population, we might be picking up more infections than if we were screening sort of older people. And so that's another thing we have to think about when we extrapolate kind of to the whole population.
Right. So that said, Doctor, are you concerned about these newly detected asymptomatic cases?
No, I'm not. I think that, once we started to do screening in the way that it was being done, they were going to be picked up. We knew sort of from studies here and in other places that there were a large amount of asymptomatic infections. The important thing is going to be sort of, understanding what that means in terms of transmission and the measures that need to be continue in place.
Well, Dr. Clapham, thank you so much for taking the time to speak with us. We've been speaking to Dr. Hannah Clapham from the Swee Hock School of Public Health at NUS.